Dear neurologist, when should you send your patient to palliative care? In case you're wondering what a neurologist is, they're the brain doctor. So there are lots of times when a neurology patient or even someone who is in primary care with neurology problems should come see palliative care or could benefit from a palliative consult. And some of those times are specifically related to dementia. So dementia is something that can last for years. And sometimes when someone gets a diagnosis of mild dementia or cognitive impairment, they don't really think about palliative care just yet. But I want to tell you that this is actually a very good time to think about palliative care. And the reason is, if someone has not had very good discussions about advanced care planning, then this is the time while they have decision-making capacity to do these advanced care plans. Doing a living will, writing down their POA, getting these documents notarized or signed by a lawyer if needed, like doing the things in advance of losing that capacity to make their own decisions. Because down the road with dementia, there may come a time whenever they cannot make these decisions. And if you didn't talk about them in advance, they're going to have a hard time actually understanding what these things mean and not be able to make proper decisions about them. Now, of course, the other time that's really good to get palliative involved with dementia is when there is decline. So whenever you're noticing, this person's in the hospital, they're not eating well, they're not sleeping well, they're starting to have hallucinations or delusions, there are some other things kind of breaking down. This is a really important point to get palliative involved so we can kind of help guide them over what to expect and when hospice might be appropriate. Some of the other neurology conditions that are really great to get in with palliative care. So one is MS whenever it's getting worse, whenever it gets to later stages. ALS at any stage. I think ALS should always be sent to palliative care almost right away. And a lot of times included in these are any of those other weird neurocognitive type disorders that are going to be degenerative with time, like Huntington's disease, for example. Getting palliative involved early can help the family and the patient know what to expect and also plan for the future. So I hope this was helpful. Save this for later if you found this to be helpful. Share it with someone who you think could use this information. And as always, follow along for more.